On Saturdays from 3 to 4 p.m., I am Dawn Reese with Hollywood Connections. My show is exciting. We have major stars, major artists, major movie producers, agents, casting directors. I even help cast for Home Shopping Network. You might be on that show as well. We have new talent segments be discovered. Remember Hollywood Connections on Saturday from 3 to 4 on Tan Talk Radio. I'm Dawn Reese, your host. Tune in.
This is the Tan Talk Radio Network.
The Karen Rizzo Show on the Tan Talk Network. This is the show for seniors, caregivers, and their families. She is the author of the best-selling book, Aging in America, Navigating Our Healthcare System, which is available at Amazon, Nook, Kindle, and at agingguidebook1.com. Having worked over 20 years in the industry, she has the insider information about the healthcare system and how it works, and will help you navigate around the business side of aging in America. She also works as a patient advocate, consultant, and educator. Now here's your host, Karen Rizzo.
Good morning, Tampa Bay, or should we say happy Groundhog Day, except in Florida. It basically applies to palm trees on the beach. So we'll continue with our lovely Florida weather, and we don't have to worry about spring, as we usually just get summer and fall. Basically, we're here today talking, continuing this show on educating and empowering patients, caregivers, families, so that they understand all the different components of aging in America, all the different options that are available and the situations that can arise. But because we do have a very much a for-profit healthcare system, this show is really geared to give you the education, the information, and the insider scoop on how to navigate your choices and plan ahead, really. We had a very good Senior Empowerment Day last Saturday in Largo. We had people discussing all the new scams, and I'm going to get into a little bit of those so that if anybody's has parents or grandparents or are getting barraged by phone calls, there's a whole bunch of different resources available. I learned a bunch of new things, so that's always helpful. And what we're going to discuss today is on how to choose assisted living and basically what different kinds of senior living options are out there. Now, years and years ago, we used to have only nursing homes and hospitals, and basically you had a choice of going from home to a nursing home. Well, in the 90s, especially the late 90s here in Florida, we started seeing a whole lot of independent living centers, assisted living centers, memory care centers. So now there's so many choices, and people get confused constantly. So I've invited Cynthia Delankar from Princeton Village of Largo as our guest today. So welcome, Cynthia. Thank you for coming.
Thank you, Karen. It's great to be here.
She works with seniors and their families every day that are trying to make that decision. And just to give the listeners just a couple of little stats about it, there's over 750,000 people nationwide living in assisted living centers. So we know it is something that people are needing to use as they live longer. The average monthly rate can be between $3,500 to $5,000 a month. So the cost factor is something people need to plan for. But Cynthia, maybe you can describe the average family member that you work with every day when they're trying to make this decision. They come in for a tour.
Yes, Karen. There's definitely been a shift in the aging population and the transition from home to assisted living. More and more we're seeing the elderly in their late 80s, 90s looking for assisted living from home, where before they usually were a lot younger. The family members looking for are truly mostly the baby boomers. And it's very stressful because they don't have any history of how to search for this. Their parents were not exposed to this. This is a new system or a newer system in healthcare. So really they're starting from scratch. And unfortunately, their parents are also very nervous about the idea of moving into an assisted living environment because they tend to compare it to a skilled nursing home environment. So there's not enough exposure, there's not enough understanding, and it's usually a very stressful situation at first.
Yeah, and so that's one of the reasons why we wanted to have a whole show dedicated to understanding what the differences are. If you look it up online, basically the difference between assisted living and a skilled nursing environment entail things like a private apartment, recreational activities, whereas nursing homes are turning more into the rehab side component anymore. And one of the things that makes Princeton Village and the team there very unique is the fact that they have the ability to let people age in place. And maybe you can talk about that, and we can then discuss the different licenses that these facilities have, because they're not all created equal.
Absolutely, absolutely. So the idea of aging in place, again, came about to the fact that most of the seniors that are in assisted living, at some point, they may need some skilled services. And in order for them to stay in assisted living as opposed to go into a nursing home, the system has changed and licensing has been expanded so that they can have these medical services, skilled services, if you will, by a nurse within a assisted living environment. And so the idea of aging in place is for them to stay in their homes that they've created in these communities and not have to go transition into a medical facility such as a skilled nursing home.
Right. And I know for those that are ever having to go on the search, there's a standard assisted living license which doesn't require nursing 24 hours a day. So it does usually have access to a nurse, but not 24 hours a day. And so that limits the amount of seniors with chronic illnesses that they can take in. Then there's the next level, which is a limited nursing service, and that brings it to the next category where they have access to a nurse 24 hours a day, but that still might be just on call. And then there's a new licensure that's cropped up in the last 5 years or so here in Florida called extended congregate care, and the ECC requires it's surveyed by the state yearly, and it does require an RN 24 hours a day to be staffed. And if they have people that are living in the center that are utilizing ECC, then they have to have a certain criteria. So it gets a little bit more into, like, maybe you can discuss some of the residents that need the ECC services.
Sure, absolutely. And just a quick correction, though, Karen. The requirement is an LPN. So most of the communities will have an LPN because that's the practice that they have in assisted living. Mm-hmm. Some may choose to have an RN, but typically they will be LPNs in charge of the building. And with an ECC license, we can do services such as oxygen management. We can manage catheters, ostomy bags. We can even take care of a feeding tube, which is a very
that's huge,
very delicate, very complex process. So we certainly have to have a nurse on site 24/7. Now, by expanding this license, it allows us to have a nurse on site, which then helps us manage diabetics residents who need insulin injections. They might be on a sliding scale. And that's really big because a lot of communities are not able to care for residents that have diabetes, because you never know what can happen overnight. So if you don't have a nurse overnight and there's an episode and the sugar drops and they have to be rushed to an ER, it's easier to have a nurse that can administer the insulin, and it's required. So it's a great benefit for the diabetic management system.
Well, it probably definitely helps them avoid hospitalizations, which is a huge push right now, is keeping people out of the hospitals as much as possible. Also, you can also manage people who are oxygen dependent as well, right?
Right, and oxygen dependency, when someone first starts with oxygen management, they may be able to do it on their own, but as they age and they get a little more confused or just weak, they will need that assistance. They will need someone to step in and assist. And at this point, we are still required to have a license with a nurse to manage that. There are some transitions taking place with the assisted living regulations, but we are still in need of a licensed nurse to manage the oxygen.
Right. Well, what I think I really appreciate about the whole concept of assisted living is it's nice for them to receive medical services that they need, such as physical therapy or occupational therapy, but still have the recreational programs. They've done studies, and seniors that are living in communities do live on an average 3 to 5 years longer, just because of the emotional support, the socialization, the nutrition, the whole saying of it takes a village, and it's pretty much all hands on deck. But what do you specifically notice about some of the recreational programs that are offered in assisted living?
Well, A lot of the residents that move into senior communities, they're moving in not because they want to, but because their children have, come to the conclusion that it's the best choice. And at first they might be a little hesitant. A lot of them may be shy, introverts, not very social. And what I've seen in my experience is that those particular residents that come in very reserved, perhaps suffering some depression from the transition, once they are pulled into activities and get to meet other residents that are, similar cases, and have that TLC, they really come out of their shell and they really thrive. And it's really great to see that we become their extended family. And their families actually come to visit, and sometimes they actually want to plan, on staying at the community, and they have things to do, they have their schedule, they have their lives, their personal lives within that community. So I think for independence, and communities such as assisted living helps the residents have a better relationship with their children, because they actually have a calendar of activities. They have things to do. They have their friends that they've made in the community. So it's really a transition for the better, and it's really important to keep their independence. And by being in a community, they're actually more independent than being at home and getting assistance from their children.
Yeah, especially at home, the activities might be watching TV, making lunch, doing laundry, and then watching TV again, with going to church or going out to the store on the weekends. But one of the things I've noticed is that most of the communities have some type of an ambassador program where there are seniors that volunteer to help with the residents through that initial transition. And this is somebody who, like you said, is already gone through the transition and is thriving and can kind of help with that depression in a senior helping senior kind of way, offering their friendship. How many ambassadors do you have working at Princeton Village? I know you have quite a few.
Right. We have anywhere from 4, 5 to 8, depending on who is on a rotation. We have a resident that's been with us for 9 years.
Wow.
And she is phenomenal. She's very helpful with the new residents. And truly, it gives them a purpose, and also empowers them, and gives the new residents someone to relate to, because there are things that they're going to say to a fellow resident. They're not going to say it to me. They're not going to say to their family members. So it's really a bonding time, but also a guidance into what it's like to be part of a community. And the ambassador program is really, really helpful in that manner.
Yeah, and now that they've seen the studies of people over 65 who are continuing to work, I think having a purpose, a goal, having something that they look forward to, that they enjoy to do. And I was looking at some of the stats, and like you said, they are getting older. Right now, the last year's report showed over 54% were 85 years or older. But what was interesting, 74% were female. And so for the guys, if you want to get some female attention, only 26% are older males. So and we are seeing a trend where some of them are coming in a little bit younger with disabilities. So there are different communities based on the needs of someone, either if they are, like you said, in that baby boomer, younger 60 to 75 age group versus the 80s and 90s. There are different communities that kind of cater to different age groups. And I think that's nice to see, too, because for the longest time, as healthcare professionals, if we had a 71-year-old with a stroke, that's fairly young in our world, and we would be challenged. Where do you put them? Because not necessarily do they fit into a younger mental health, if you will, community that caters to that. But at the same time, there are now facilities that are specifically developing programs for that younger one. So it's nice to see the variety is the point. For the longest time, here in Pinellas County, we would struggle, and in the Tampa Bay area, it would be real challenging to find well-run communities that, because the state does come in and do an annual inspection, but that had the standards, because assisted living communities, by and large, have been more loosely regulated than, say, nursing homes and hospitals, who have to have mandatory JACO and quality initiatives, and because they're getting Medicare money,
Right.
they have to be under the spotlight a lot more. So now it's nice to see that there are companies that are voluntarily, if you will, self-regulating and kind of meeting those standards. In a minute or so, we're going to take a quick break, but one of the things that I know a lot of families are challenged with is, how do we pay for this? Seniors are living longer, and they are sometimes, in many cases, outliving their assets. So after we take a quick break, we're going to come back and talk about some of the programs to pay for it.
Okay, sounds great.
This is the Tan Talk Radio Network.
Are you caring for a loved one who needs more time and attention than you have to give? Arcadia Home Care and Staffing provides specially trained companions who provide personal care with an extra measure of warmth and professionalism so those you care about can have their needs met right at home. Keeping your loved ones in familiar surroundings can make a world of difference in their quality of life. Call Arcadia today, the Quality Home Care Service. All Arcadia caregivers are background checked, bonded, and insured. In Pinellas or Pasco, call 727-579-9414. Other areas, call 813-306-0007.
Listen, do you hear that? It's the sound of your senior care community's IT systems running smoothly. In this time of ever-changing regulations and requirements to share electronic health information, that's not easy to achieve. After all, you're in the business of taking care of people, not computers. Let the team at QShift, Inc. put our 30 years of healthcare IT experience to work for you. Think of us as ever-vigilant partners working to manage your electronic health records, IT planning, network security, systems integration, and IT training needs. With affordable solutions for skilled nursing, assisted living, and continuing care communities, the QShift team has the services for you. Why QShift? Because we're there for you every shift, every day. So go to QShift.com, that's QUESHIFT.com, or call Rick at 717-428-9020 to learn more.
This is the Tan Talk Radio Network.
Welcome back, everyone. We're here discussing on the Karen Rizzo Show on the Tan Talk Network the how to choose assisted living, all the different senior living options that are out there. And we have Cynthia Delancart from Princeton Village of Largo as our guest today. She's a sales counselor for the facility that does have an ECC license here in Largo and offers both assisted living and memory care. One of the things that we're noticing a trend with, as you stated previously, that people are making that transition into assisted living a little bit older in life than we used to see, like late 80s, a lot of 90-year-olds moving in. And I know that sometimes families think that they're completely and totally prepared for every outcome in retirement, and then they get there. Or mom's going to make it to 100, and, that's just the way it goes. Or grandma's going to make it to 100. So what are some of the programs that you work with or that you refer families to that maybe some of our listeners don't even know about?
Yes, well, unfortunately, affordability is an issue with assisted living. Assisted living is not a medical facility, and it's not connected with Medicare. That's a major misconception when families are searching for assisted living services.
Yeah.
It is a private pay community. So that in mind, there are programs that assist. A very big one is the Medicaid long-term managed care. It has gone through its changes in the last couple of years, but ultimately the idea is to keep seniors out of the nursing homes for those that don't need to be in a nursing home because it costs the state a lot more. So they will help families with a certain portion of the cost of assisted living in order to transition into that environment. There are some challenges, though. There is a long waiting list for it. There are some exceptions to the rule. If someone is hospitalized and is accepted into a short-term rehab facility, then there are processes that can take place to speed up.
They're bumped to the top of the list, if you will. If they're in a nursing home, they don't really need to be long-term in a nursing home. They do get kind of a priority status for approval on that long-term, and that's called the Medicaid long-term care division is what she's referring to here, what we're discussing. That took a lot for us to get that approved here in the state. It used to be called diversion, and now they call it the Medicaid long-term care because it offers both home care and assisted living, which, is a big change. But what are you seeing in terms of what families can pay if they are approved under that Medicaid program?
Well, what's great about it is that it can help up to 1/3 of the cost.
That's pretty good.
In the 1,100 range,
Okay.
the monthly fees can range, as we discussed, between $3,500, $5,000 to $6,000 a month. But the average cost for assisted living with an $1,100 contribution from Medicaid can be a great help. There are stipulations with the approval, a certain number in Social Security as well as private funds. They have to be depleted before you are approved. But there are also methods in which elder law attorneys can assist with that process as well. The major thing is if you think that you're starting to need assisted living, if you're thinking about it, you're already there. So you should look into all of this ahead of time instead of waiting until something happens and a crisis situation, you're hospitalized, and then you need it. Now, I say that to the seniors, but truly it's for their children listening. The children need to be proactive. They need to make these plans ahead of time. So if mom and dad are living at home and they're doing okay, well, perhaps you should start at least applying for Medicaid if you know the finances are going to be a challenge in the future.
And people are surprised that they can have up to, I think it's $90,000 in assets, liquid assets, if they're a married couple. They can own a house, they can own a car. The state doesn't require them to be completely destitute or dependent strictly on Social Security income. But if there are large amounts of assets, that's one of the reasons we had Jack Rosenkrantz on a couple weeks ago to discuss. There are legal methods that they can do actual estate planning and Medicaid planning if we think that one or both parties might need some of these services in the future. So, definitely contact an elder law attorney if the assets are there. But a lot of people don't realize that even if you have significant assets, you don't have to deplete them to be eligible for these Medicaid programs, which we finally do have some available. Like you said, sometimes there's a wait list, but there isn't a wait list for the home care piece of it. So say mom and dad are having some challenges, they might have a decent size savings and portfolio put away, but contact an elder law attorney because they might be eligible for a little bit of assistance in the home, like maybe some shower visits or something. And the state of Florida has contracted with private duty home care agencies like Arcadia Home Care, one of our sponsors, and others to provide caregivers that are CNAs to come into people's homes and into assisted living facilities and offer those centers, offer those programs. So that's kind of a good one. Now, my favorite one is the aid in attendance.
Yes, absolutely. On behalf of all the seniors and caregivers out there, we thank our veterans for serving our country, and we are very pleased that there is a benefit that can assist them in their times of need. And it's the VA aid and attendance that can be very helpful. There are guidelines for that as well. But ultimately, it can assist with a substantial amount in the 1800s.
Actually, the current one for a couple is $2,120. They didn't have a cost of living raise, so the number stayed the same. This year, we were all waiting to see if the seniors would get a cost of living raise, but sadly, that did not occur. So the VA kept their numbers and their requirements the same. One of the things Jack was talking about a few weeks ago that I'm not sure if you know about, but in August there's going to be a law change where they're going to be doing a look-back period on assets for the veterans' benefits. So definitely you want to contact either a veteran service officer or an elder law attorney. But if mom or dad served World War I, World War II, Korea, these were all mandatory drafts. They didn't have a choice. I mean, these people were drafted to go to fight for our country. They did not, and a lot of what always cracks me up when I'm talking with large groups of seniors, if you say to them, who here is a veteran, you might get one or two veterans in the room. But if you say, who here served your husband's service, who here is the spouse of a retired military, then half the room goes up. So even though say for instance dad or grandpa has already passed on, the retired spouse would still be eligible for these benefits. So a lot of people forget that piece of it. And like you said, it's a game changer for some families. I mean, getting an additional, $1,700, $2,000, whatever. And they also have a widower's benefit now. And there's also a caregiver benefit that got added 2 years ago, where if an adult child is actually the full-time caregiver of a retired veteran, there's an additional money. It's up to like $900 a month that household receives. And this is in addition to Social Security, in addition to pensions that you might have. So it is definitely a really, really good benefit and it's not very publicized. I mean,
It's not. That's a well-kept secret, honestly. And you really need to get in touch with the right resources to get that information. The Pinellas County Veterans Services is a great resource for veterans to discover more information about VA aid and attendance, as well as any other services that they are eligible for. And one more detail about the VA aid and attendance, which is very beneficial, is that when you are applying for assistance for an assisted living facility, it's retroactive. So you will receive benefits that are, sometimes 5, 6, 7 months that it takes for the application to go through, but you'll receive those funds back to you. So if you have to pay out-of-pocket costs during that time, there is a retroactive payment, which is
huge.
Which is really, it's very helpful.
It's really helpful to cover the cost of that. There is an income stipulation, like you said, and so if an estate is greater than, I think it's 80 or 90,000, Jack was saying, then you definitely need to contact a veteran service elder law attorney, somebody who's actually trained in that application process. And don't be fooled, people. If you run into Joe Schmo who says they're going to get your assisted living benefits or they're going to get your VA benefits for you, it's illegal for you to be charged by anyone other than an elder law attorney, a licensed practicing elder law attorney in the state of Florida. The veteran service officers, maybe you can share with everybody those contact information if you're under that income or asset.
Yes. Well, and that's there's some confusion. Should you talk to an attorney? Should you not? If your income is within reason and within the guidelines for VA aid and attendance, if you've already done your research online, I would suggest speaking with Pinellas County Veterans Services. They have multiple offices: Tarpon Springs, Clearwater, Largo, St. Petersburg, and you can find that information online. This is a free service for you. Okay, you speak with officers that are trained, that know exactly what you need to apply for the benefit. You do not necessarily need to speak to an attorney, but if you do have assets, that's where an attorney comes in and can be a great help. So those are resources that you can certainly dig in and find out more information.
Yeah, and locally, I know Michael Dowling, Michael Hill, they love it when I pick on them, but they have been working with veterans and our retired veterans and spouses and families for well over 20 years. Recently, he was one of the featured speakers at a conference, and he said every time he goes and he speaks, the next week his phone never stops ringing. So sometimes you have to leave a message, but it's well worth the time to, like you said, we've gone from 2 Pinellas County Veteran Service officers to 8 in the last 4 or 5 years now. So and like you said, we have the Tarpon Springs office, we have the Clearwater office, as well as St. Petersburg now. So definitely contact the veteran service officer, because they'll let you know. They can just pull a Social Security and date of birth, and they can tell you whether or not your loved one's eligible for that extra money, and it is definitely worth it, especially if they've served. They do have there are some other conditions. They can't have been divorced. They have to be honorably discharged. But if they meet, which most of our retired military, if they've met all those requirements, the money is there to help pay for the extra assistance that they're going to need. One of the things, too, that when we were looking at how to find the right, because it is a matching game, finding the right center, because just like choosing a home can be difficult. It took me over 6 months with a realtor. I think she was going to go crazy with me. But just like when you're choosing a home, like where do you want to live, what neighborhood, what schools, when you're older and you're choosing assisted living, it is a matching game. Is it the right group, do you feel comfortable? Do they have the food you like? Do they have the recreational programs you like? Do you want it busy? Do you want it quiet? So when you're finding this, there is a website I found called floridahealthfinder.gov, and you can put in kind of like your criteria of what city you want to look at, for instance, or what area you want to look at in the region, and it'll even direct you to their most recent surveys. You can have pictures or go to their website. Some of the communities offer a virtual tour like yours does. I was on the website going, wow, these pictures are pretty. And that's, of course, shameless plug for Princeton Village of Largo.com. But it is one of the best kept secrets in Pinellas County because it's tucked away. It's near a garden. It's quiet. But everyone chooses these differences based on where they feel the most comfortable, and then whatever their resources are available. Maybe you can explain the importance of an 1823, because even though it's not a medical community, right. It is one of those pieces of papers that
keeps me up late at night.
I'm sure. I have days that we've chased after them to try to get somebody admitted.
The 1823 is basically, in layman's terms, it's the doctor's orders on how to care for the resident in an assisted living facility. So in order for us to admit someone into the community, we have to have a primary care physician, whether it's their primary care or it's the primary care that's overseeing them in a hospital or a rehab center. Someone in charge will need to sign that 1823 for us to have them admitted. And basically, it's just a doctor's orders. Do they need physical assistance? Do they have any medical needs, such as catheter management or oxygen management? What kind of medications are they on? They can, if they can manage their own medication, they need assistance with medication. So details on how to care for that resident, as well as information about their medication. And it's very important to have that completed as soon as possible as well, because most people don't realize that it's sort of a chasing game after the physician. Most physicians are not that familiar with it as well,
right.
Unless if they are specialized in geriatrics and they've been recommending assisted living communities for their patients. So it's a tricky little document, but just give yourself a little time and make sure you get that done.
Well, and it's funny because even though, like, if you look at the regulations, it says that they have 30 days to get that document. I don't know a nurse alive that's going to risk her license administering medications to anybody without having a doctor's order for that medication.
And here's a good point you just made. Although there are 30 days with medication, if we are assisting with medication, which is the number one reason why residents are in assisted living, then that doesn't apply. The medication list has to be signed within the 1823. So it's really
yeah, it's a funny law.
Yeah, it's a funny law. So really, you have to have that 1823 in place, because most residents, I don't know any resident really that's truly managing their own medication in assisted living. In independent living, that's a different story. But assisted living, generally, that's the number one, the first step into getting assistance is managing that.
Well, and it's interesting because the CDC brought out a report that just hit my email last week that the leading cause of death in older adults is falls. And we know that falls, and then the second one was motor vehicle accidents.
Wow. So
one of the great things about assisted living is it kind of takes care of twofold both of those dangers, because transportation's offered at just about every assisted living facility I've ever seen. But, I'm sure there's a few out there that don't have it. But most of the communities offer transportation, they have nurses, they have fall preventions, bed alarms. But the difference with assisted living is they can do this in the comfort of a private apartment versus a medical institutional looking nursing center. And anymore, some of the nursing centers can be a little deceiving. Some of them actually look like they're assisted living communities, but they are still skilled nursing. So there is the differences there. One of the other things that I'm glad to see people getting away from is they used to call the memory care centers locked units. And I'm glad to see us getting away from that verbiage. And now it's more engagement programs are there. They're secured for safety reasons if someone's an elopement risk. and could wander or has that sundowners hitting. So maybe you can talk a little bit about the memory care center that you have. I understand you got a new director for the program there.
Yes, Marty's absolutely wonderful. Memory care, that is a tricky system when people are looking for lockdown units. Sometimes there's some psych issues and they have a misconception of what memory care is. Memory care is just a division of assisted living with a more structured environment. You have a higher ratio of caregivers for the residents because you need that constant recueing and reassurance, the extra TLC for those that are confused. There are good days and there are bad days. So the staffing is very important to have a higher ratio of caregivers. In terms of the lockdown aspect of it, for example, our memory care is on our 3rd floor. So our elevators have passcodes. It's a secured system so that the residents are not able to hop on the elevator and go downstairs and wander. Not all memory care residents do wander, but for those that do, that's why we have the, quote unquote lockdown. But it's not really a lockdown
secured.
unit. It's a secured, exactly. And for those memory care communities that are on the ground floor, generally the doors and the fences are locked as well for that security. So different types of memory care communities, but at the end of the day, there's still private apartments if you are not into a sharing situation. You have your little kitchenette area, if you will. You have your common areas for activities. You have your, patios and such. So it's the same environment as an assisted living environment. It's within that assisted living world.
Right. I think the main thing is that the staff have that additional training. They have the cues and the training for the Alzheimer's dementia seniors, so they know how to approach them. They know how to redirect them, how to handle their changing needs with the patients that is required. And there's the extra staff, so it doesn't feel like everyone's burdened as much either if they do have their, like you said, some of their bad days. One of the things that is interesting to me that a lot of people have a misconception about assisted living, and this is probably where some of the financial money guys are going to love me right now, is that a lot of families do think that Medicare pays for all of this, and they don't. So that's one of the reasons why, as a community, we try to look for these additional resources. But keep in mind that long-term care policies are still available. They do have elimination periods, usually a month or 60, 90 days. But if you have, or mom or dad or grandma or grandpa have one of those policies laying around, it's a good thing to call them. Some of the old policies, Bankers, Prudential, Principal, I've been in households where they're literally, you can see the moths coming out of the file cabinet, and they pull out these policies. But guess what? They're going to pay $2,000-$3,000 for the care, so it can really help. Sometimes they've been paying on these policies for years. They don't even know they're paying them because it's an auto recurring thing in their bank accounts. Mm-hmm. But it is one of those other things. Just a checklist if you're looking at the future need of assisted living. And one of the things that we have found is the socialization component is huge for seniors that are thriving in these communities. I had a gentleman that I had been after for 2 years. This is going back about 10 years, and I'd seen him at the senior center all the time. And no, I'm leaving my house feet first. That's what you always hear. Right. And as soon as he moved in, he said, "Why didn't I do this earlier? Now I have energy for the things I want to do instead of the things I had to do." So having help with housekeeping, laundry, meals preparation, but still having the ability, like having, like you said, a microwave, a refrigerator, a kitchenette, having that ability to have your own snacks, drinks, whatever they happen to be that, is allowed. They're allowed. And also, I've seen pets, too. So maybe you can discuss a little bit of the pet policy, how that usually works.
Well, we actually welcome pets in assisted living communities because pet therapy is huge with seniors, and particularly to memory care residents. It's a great way to reach them. So we do have visiting pets, but we also allow our residents to have pets. Right now we have a dog, a couple of cats, and a bird. And we've had a Dalmatian there before, too. So we don't have a limit on size as long as they're docile, and they're not going to be attacking anyone, then we're fine. The pet is also interviewed and assessed to make sure that they are appropriate for the community. But yeah, it's just like living at home, only you have a team of people assisting you when you need it.
Right.
The idea is for you to stay independent. It's not to take away your independence. And I tell you, families, nobody's really looking for assisted living, but families have really learned so much from it. And now they're looking the children are looking down the line and they will need it someday.
Right.
So it's important to make those preparations. You mentioned long-term care policies. And to be honest, I'm looking into it as of now because we don't know what tomorrow brings. And
Right.
yes, you may think that you're staying at home until your last day, but you don't know how things will turn out. So it's good to have a plan of action.
Well, and I've always found that the seniors that had a relationship with communities independently, not forced upon them by their children or doctor or the healthcare professionals, but that volunteered somewhere, they seem to have an easier time when they realize that they need more help. They already have a relationship with the community. They realize it's not going to be just people sitting around drooling in their wheelchairs, that they're actually engaged, they're busy, they're doing projects, they're interacting with churches, communities, schools. It's a busy place, and that there's different types of communities for different types of things. One of the things that we're going to be getting into, for those that are following the shows, you can always look at any of the shows you've missed here on YouTube. You got to look at the Karen Rizzo show. That's Karen with a Y, because my parents were hippies, and it's true, so true. And one of the things that is going to be really helpful as people are living longer, as families are more displaced, as we have families living all over the country, adult children all over the country. Next week, we're going to have Monica Stanchula on the show. She's going to be discussing reunion care, which is some of the newer technologies of websites that are out there that families can use to stay communicating. One of the things I know your team at Princeton Village does, and many people might not realize this, that there's a resident council that meets. Maybe you can tell the listeners how that usually works.
Yes, they meet once a month, and the residents are in charge of the community. I like to say that we work where they live. They don't live where we work. It's their home, and we're there to help. But they run the show, and they have a resident council so they can make decisions and vote on things that they would like to change. Maybe there's some changes with the meals, and they would like to discuss that, or maybe activities, or maybe transportation, outings. This is a chance for the residents to get together and discuss it with our administration as well, and go over some of the things that can be changed, that can be upgraded, or to remain. The population in assisted living changes, so as it changes, you have different needs and different wants. Mm-hmm. The services in terms of assistance, physical assistance and cognitive assistance, are always going to be there, but those little details in terms of activities, primarily food. Activities and food, mm-hmm. that changes. So the resident council is important because they make those decisions, and they request those services from us. And like I said, we work where they live. So,
right. It's nice to see them too. Like when they say they want to have a picnic on the beach, that the staff can accommodate that. If they want to have the Wii games more, or they want to have different variety in food. I mean, the older we get kind of like they're still learning, and a lot of them, their brains are still completely 1,000% with us, very alert and oriented.
Absolutely. Mm-hmm.
So, for them to be able to call the shots, I think is really a huge sense of empowerment for them. And that shows the respect that they've earned. And that's the difference with Americans versus a lot of cultures. Like, they have, in Canada, they call assisted living facilities aging care homes. And they have a completely different approach to them. Some of them have a greenhouse for their fresh, like urban garden kind of concept for meals. In some of the countries, European countries, especially in the Middle East, they don't have any homes like this for their elderly because their cultures demand the adult children to be the primary caregivers, and they would consider it to be an embarrassment on the family to put mom, dad, grandma, or grandpa away. But as Americans have to work, and we all have sandwich generations where a lot of us are raising our own children while dealing with an aging parent, it's nice to know that there's choices and there's a variety of places that people can choose from. So again, if you're thinking mom or dad's going to need something, check out that website, floridahealthfinder.gov. It's neutral. It'll direct you to any location website. And if you are using a placement agency, keep in mind that the placement agency doesn't charge you, the family, but they will charge the facility. Usually it's 50%, 75%, or a full month's rent. So sometimes people don't understand how that works because it looks like it's a free service. You know, Medicare isn't paying that bill, guys. It doesn't work like that, even a little bit. So one of the things, too, that if you are interested in getting a copy of Aging in America, Navigating Our Healthcare System, there is a whole chapter dedicated to veterans benefits, another chapter dedicated to choosing a nursing home, and then another chapter that's completely dedicated to what to look for in assisted living communities. And if you don't have access to the internet, and I know some people don't, you can always mail a $19 check to Elite Marketing at P.O. Box 7221, Seminole, Florida 33775. Again, this is just a book that that when I was working and wanting to purchase one, I couldn't really find one that had all the components that families struggle with. So it took me a few years, but I just decided to keep at it. And every time I'd have a bad day, I'd add another chapter. But one of the reasons is because you can't assume that Medicare is going to pay for everything, because they don't. And you can't assume that you're going to be able to stay in your home for the rest of your life, because the odds aren't there. The odds are that 75% of people 65 or greater are going to need some type of long-term care services. Now, if we could get a 75% return on a CD, would we do it? Absolutely. If we could get a 75% return on an IRA or a 401k, I mean, those are better than Vegas odds. So, the truth is, being empowered and being prepared is the whole theme of this show. You can always contact questions on agingguidebook1.com. If you are struggling with a parent and you need more one-on-one information, you can always email me at agingguidebook@gmail.com, or you can call into the station here, which is 727-441-3000. We are very thankful for our sponsors every week, which is Arcadia Home Care and Staffing and QShift, which interestingly, we were discussing last week. I had Rick Carter on the show, and by 2024, the move for all things electronic health records is even going to be hitting assisted living communities.
Wow.
So that's a big change for the way we've always operated. It'll be interesting to see the dynamics. It's already hitting hospitals and doctors' offices and skilled nursing centers. So the move to integrate a seamless flow of personal health data, which with the whole goal of cutting out medication errors, making sure people are compliant with diets, that we all know what our personal health history is, and actually they're moving towards independent portals. So you and I, by the time we get to having to cash in our long-term care policies, will probably be way ahead of the game, and I fear for anyone who's going to have to take care of us, because we're going to be probably the worst kind of patients out there.
Absolutely.
Yeah, exactly. So one of the things, too, that I have a lot of people have asked the question, how do you get mom or dad out of the house if, the key components are they driving, accidents, they can't remember if they've taken their medication on time, so there's medication problems, or they're seeing a decline in hygiene. What are some of the tips that you've always shared with your families when they really need to be able to say, Mom, Dad, it's time. This isn't working anymore?
Yes. Well, depending if the resident or the senior is living at home alone and the family is out of town, sometimes it's good to just take a look at respite stays. Respite is a term used in assisted living relating to temporary stays as a trial basis or just as a break for a caregiver. Sometimes caregivers are living with the seniors and they just need a week or two to go on a vacation, to take some time off. So they will look for a community that does respite stays so that the senior can stay for a little bit. What I like to do personally with Princeton Village, and has been working quite well, is giving residents a chance to test it out, a test drive, okay? So we do 30-day respites at Princeton Village for those that are not, ready to make that final commitment. And it also empowers the senior to make that decision. You're not being forced into a community. You're simply trying it and seeing if you like it. Now, it's different. When you buy a home, you can't test it. And when you rent an apartment, you sign a 1-year lease. Well, assisted living is a month-to-month rental. But also there's a commitment when you move in with furniture and your, details. But with a respite stay, it's furnished for you. You can try it out, whether it's 7 days, 14 days, or 30 days, and see if you like it. There's so many different communities to choose from. So sometimes, quite often, the first one is not always the one that you were going to end up in. You might have to make some transitions within that world. So it's good to have a platform so you can try it at first.
And a lot of people I've heard from a lot of caregiver support groups that they didn't know what respite was until after their loved one maybe passed away or something. So it's always good to know. If you are a primary caregiver, especially a lot of people don't realize that the Alzheimer's Association actually offers a respite benefit for people that are low income, where they sometimes will pay for a couple days or a small percentage of what the respite cost would be. And I know there are communities that, while people are getting their aid and attendance money to pay for that care, that they have at least a little bit of a break. Some communities will offer support groups. Sometimes they offer different activities. I mean, most of the communities I've ever worked with or been around will always let you come in for lunch.
Oh, yes, absolutely.
Lunch, dinner, or an activity. Come see if you like it. See if you like the people who live there. If mom or dad will be comfortable there. And like you said, respite's a great program because it's not a big commitment that is going to be a burden or, now I'm stuck. So,
right.
Which is always the fear.
Well, the whole idea of assisted living is dignity. Right. So by giving choices, you're still keeping their dignity and the ability to make decisions for themselves. After all, they're the ones that are going to be living in that community. So
right. And a lot of people don't realize that even the state, when they come in and do surveys on these facilities, there is actually facilities will be tagged if they violate dignity of the residents. And a lot of people don't understand that. That's so embedded into the healthcare communities now, because we know that's a concern that elderly and older adults have had here in this country for many years. They want their dignity kept intact and and as much independence as possible, which is great that when we have the opportunities to be able to showcase the communities that are doing that. One of the things, too, that we're going to have in an upcoming show, I just wanted to mention to everyone, we're going to have Empath Health coming in to talk about taking care of chronically ill patient or terminally ill patients, because I understand that even sometimes in your facility, hospice can come in and they can actually stay clear to the end in their apartment with as much comfort as possible. So as we're wrapping up the time, I'm getting the cue here. Keep in mind, everyone, that navigating our healthcare system can be tricky, but you don't have to do it alone. There's a lot of healthcare professionals that are happy to help you. And if you need more assistance, you can always contact agingguidebook1.com or email agingguidebook@gmail.com, which comes directly to me. And hopefully this show is helping you age healthy, wealthy, and wisely. So we'll see you next week.